My name is Natalie Asensio, and I am one of the admissions and recruitment coordinators here at the UCLA School of Nursing. Here we have our alumni panel. Please give us your name, what year you graduated, and where you are currently working.
Alex, I graduated this past year, June 2023, and I'm working at UCLA Ronald Reagan.
Hi, my name is Leaz. I'm UCLA Nursing BSN class of 2020, and I currently work for Regal Medical Group as an outpatient case manager.
I can go next. Hi, I'm Magali. I recently graduated also June 2023 and now currently working at UCLA Ronald Reagan.
My name's Brian. So I'm currently working as a research assistant at the School of Nursing, but I did graduate this past June 2023. But I do start my RN job in January at Harbor UCLA Medical Center.
And the first question is, what motivated you to choose UCLA's direct entry nursing program, and were your expectations met during your time in the program?
I'll take this to start. I applied to a lot of schools when I was in high school for nursing, the Cal States, UCLA, UC Irvine. And one thing that kind of drew me to UCLA was just the community of UCLA in general. The School of Nursing is a small bubble within the huge school of UCLA, and there's just so many resources and so many activities, and it's just such a great environment. So you don't get just the School of Nursing, but you get all of UCLA, which is amazing. And I think that was something that was most exciting for me. And my expectations were definitely surpassed. I had an amazing time. I would go to UCLA 10 out of 10 times. And yeah, if anyone else wants to say, hop on that, but
Yeah,
I can definitely echo what Alex is saying. Having that small feel of having like being in a small school, but then having like the UCLA community as a whole was really exciting for me. And like Alex mentioned, there's so many resources, there's so many student-led organizations that you can be a part of, and also for me anyways, doing the BSN program, which was a 4-year program, really like I was able to take all the UCLA courses that any other student would be taking, and having the opportunity to take classes with so many amazing professors, and then also being able to take all the nursing classes with our amazing faculty at the UCLA School of Nursing was also something that I would also love to be back at UCLA. I really enjoyed my time as well.
I can't think is that this is LA. Like there's good food, it's nice weather for the most part. I mean, it does get hot sometimes, but you can literally go to the beach on the weekends if it's weather permits. There's so many food places, Sawtelle, downtown LA, and there are so many different hospitals that you're going to rotate here, and it's LA. So you'll get those connections that you need when you graduate and start your RN job. But I think Ayaz has something to add.
Yeah, I would say what motivated me to choose the direct entry program is there's so many. And when you look at SoCal as a whole, you got schools like San Diego State, Cal State Fullerton, UC Irvine, other UCs. Not many UCs have the direct entry. Cal State Long Beach is one of those that has like you have to go in the pre-nursing and then you apply 2 years later to become into the nursing major. That really drew my attention to UCLA. And when you get the acceptance of UCLA, it's kind of a no-brainer. It's UCLA. It has the prestige, the reputation of everything. Being in LA, being in West LA, just enjoying that part of college. And like everyone else has said, you don't just get the School of Nursing. It's nice to have that. I come from a small city, so to go from a small high school to like a class of 40 or 50 students, it helped. Being in that small environment, you felt more comfortable talking to professors and talking to your teacher assistants and whoever could help you. But I feel like overall, you also get to be in those big lecture halls. You get that experience. You get to meet people from other majors, so you're not just like stuck in that nursing bubble. There's like the whole UCLA community is out there, and everyone in the School of Nursing faculty, everyone was just so helpful, and my expectations were definitely met and even surpassed. And it was probably the best 4 years of my life. Besides, get all the stress in nursing school, but then you also get the fun of the UCLA aspect as well.
How did the program prepare you for your nursing career? And what were some of the most valuable skills or knowledge you gained?
I can start. So I think one of the even though I'm not clinically in the clinic yet, the program did help prepare and help me expose me to different types of patient populations. I liked how our clinical instructors, they really tried to find a patient with either a rare disease process or something that's complex, and you would rotate with that patient at clinical. So for me, it prepares me because I get a variety of patients, so I feel comfortable when I'm in the hospital, in the unit. I think, for example, my psych instructor, she found out that there was electroconvulsive therapy that was happening, and so she pulled like us in pairs to go to that room and see the doctors and physicians perform that type of therapy, which is what you learn in the textbooks but not really see in the clinic because it's such a small unit. So yeah, that's how it prepared me, and I feel comfortable even though I'm not in the clinic yet.
Yeah, I would say I agree with that too, because your professors know what are the rare things and what are things that you might see in textbooks, but when they apply and they see it you see it in the clinical setting, it's a lot more, you get a good hands-on look at it too. So I just feel like they always try to seek out those rare situations and rare scenarios that would really be important. It really prepped me because as a new grad, it's scary. I went as a new grad during the height of COVID, and we were working on COVID units. So just being able to know how to like do your isolation to gown up and gown out, all that, and then just taking care of patients who are trached or intubated. Those skills and just being able to apply what we like in the labs and the textbooks and how we can apply it to real nursing practice. It was definitely really valuable because I felt confident that I knew what they taught me is what I was going to see, and it didn't fluster me, or I didn't really like feel nervous going in those situations because I've seen it before. I've had the experience with it.
I think one thing that kind of surprised me was that in nursing school at UCLA, we have like this skills book that you go to clinical and you get these skills checked off. And after clinicals, there's also these evaluations, or like kind of like a journal. You talk about your experience, what you learn, and what you could improve on. And right now in my new grad program at UCLA, we have the same skills list. Obviously, some of the skills are different. We have the same like evaluations and journals. And so everything I'm doing right now in my real job, we were practicing it at school. And so it kind of made the transition right now as I'm starting my career a lot easier because I kind of know what to expect already. And I think that's really cool that the transition is a lot more seamless.
Yeah, I definitely resonate with everything that everyone said. For me, I would definitely say that the program really talked a lot about therapeutic communication with patients, and I feel like during clinicals, that was something my instructors and faculty during lectures really spoke to us about and really made us like ensure that when we do go and speak with patients that you're speaking to someone who's going through something and you don't know everything that's going on in their life. They could be dealing with something really hard, and just being able to actually speak to them and gain that trust and gain that rapport with the patient, that it's really important because then they're going to trust you, and it's going to make your job a lot easier if your patient is actually trusting you. And I can definitely see how something as little as talking to the patient using their preferred name, like you're not talking. For me, for instance, being in labor and delivery, a lot of the times I hear people saying like, good job mama, like you're doing so good mama, and I'm like, no, like I think she wants to be called by her name. And so even I can tell the difference when like they're being spoken to that way versus being spoken to by their actual name. And so it's just the little things like that that I feel like the faculty and everyone at the UCLA School of Nursing really honed in on therapeutic communication, actually being able to speak to patients. And I feel so confident in speaking to anybody, any patient that I may encounter. I definitely do feel more comfortable because I feel like the program really prepared me for that.
What were the most challenging aspects of the program and how did you overcome them?
I would say what was the most challenging part is when you have those labs and it's kind of like pass fail. You either do it right and you do it to perfection, or one mess up and you got to repeat it. I just think it's difficult because in that setting, it's just like high stress, high pressure. But when you're in the hospital and the actual bedside setting, it's exactly like that. This is crucial to this patient right now, and you have to do everything you can to give them the best care possible. But I feel like what helped me overcome it is when you have open lab. I mean, they're giving you opportunity all week to go practice a skill, and so you can perfect those skills. And I just like having a lot of resources and just a lot of different faculty who are there to help you. I feel like that helped me overcome that, because every week we had those skills. I felt nervous going into it. You come out of it, either you're passing or you're failing it, but it's just that nerve in that moment that's just you and the faculty, the lab faculty, and that, are you going to pass this skill or not? I thought that was very difficult, but there are a lot of great staff that helped me overcome that fear.
I think for me, the hardest part was when we started clinical, we had clinical rotations, but we also had classes. And so kind of finding my time management, my balance, like when to study, when to like do my clinical, and then when to live, when to have some fun, because it's still college. Like not everything is nursing school. And it takes a little time. Like college is hard, but once you kind of find your flow and find your rhythm, it starts to work, and you find friends who are also in the same rhythm. A lot of your nursing cohort will have the same responsibilities, same tasks, and you kind of find a way to go through it together, and yeah.
Yeah, I agree with Alex a lot. Finding that balance of being able to handle everything that is being done during like lectures and all the classwork and then also worrying about clinicals and, oh, I need to get this assignment done, but I also have clinical tomorrow, so I actually need to go to bed at a good time. And then for me, I specifically really wanted to work while in nursing school, and I know they tell you they don't recommend you working because it is a very hard program and it is very demanding of your time, but it is possible. For me anyways, UCLA had a lot of like job opportunities that were there that worked with your schedule, and so for me, I was able to work throughout nursing school, and was able to find that balance. Like it's definitely possible, just making sure you find the right place to be working at. Specifically, I made sure that I worked within UCLA so that they know, you are a student, they'll work with you. And then just trying to figure out that balance of being able to handle clinical portion, lecture portion, and then making time for yourself and ensuring that you're taking care of your health, your mental health, and all that. It's definitely possible.
I think for me, it's similar to Alex and Magali's response. It's the fact that you have 10 weeks in a quarter for a class, because yes, you do have clinical, yes, you have theory, but your theory courses where you get your tests and your midterms. So like you would get a midterm like every 3 weeks or so, you go to clinical and a week passes, and then the next week you have a quiz for one class, and then the week after that you have the midterm for the other class. So that kind of was the hardest part, transitioning to a 10-week system. And it just takes a lot of discipline. I tried to train myself with my lower division courses, with the chemistry, biology, try to train myself there, because you do have the same thing, the midterms and the exams on like opposite weeks or alternate weeks. So really take your studies seriously within the first like 2 years, and try to get your rhythm that you like, and then apply that to your nursing classes, because the content is a lot more difficult when you take those nursing classes when compared to like the chemistry, biology. It is different, but it's just a lot of information to take in.
Thank you. We will move on to the next question. Could you describe your clinical placement experiences and the types of healthcare settings you were exposed to?
Yeah, I could say that for me, we get to go from all the places. You got to go to psych facilities, skilled nursing facilities, and then you're at bedside. In med surg, you're in telemetry units, medical surgical units, ICU. You get exposed to a lot of different areas of clinical placement. For me, when I did my final immersion placement, I was at UCLA Santa Monica for Southwest. That was the oncology hematology unit, and I learned a lot. You know, you get to learn how the medications that those patients go through for chemo and how to draw labs, and it was just a great experience because that was one of the settings that I really wanted to go into as a new grad, and I got a lot of experience. Even though it was during COVID, they still gave us all the resources that we could have used and all the great preceptors on those units that could help us flourish in that under those circumstances that we were wearing masks and we were just very it was just a very new time, with COVID just being so new. It was kind of like, how do we handle this? And then when you have oncology patients, they're all very immunocompromised. They can get sick very easily. So just trying to do everything we can to give them the best care possible. But UCLA does a really good job with their clinical placements because you're not just only at UCLA hospitals. You're at, you can go to Dignity Health, you can go to Kaiser, you can go to LA, the Children's Hospital. They just give you a great vast of options. They give you many options of how you can go in there and get all the experience and all the knowledge that you need for your nursing career.
Yeah, just
Sorry.
uh,
Go
so
ahead,
just for example, I was at UCLA Santa Monica, UCLA Ronald Reagan, White Memorial, Torrance Memorial, Resnick, CHLA. I probably went to like over 6, 7 different hospitals. Got to see so many different health systems. Got to be in almost every unit, I think, except the ER. But there's like some students who had the option to go down for a day. They just give you everything, and it's really cool. And especially for immersion your senior year, it's basically 3 months. You're on one floor. You're basically a nurse, and you get to choose where you want to go, and it's really cool. And where I was for my immersion is where I am for my job now. And so they give you those opportunities, which is really nice.
How did the program facilitate networking and job placement opportunities after graduation?
Yeah, so like how Alex mentioned that where he ended up doing his immersion, which was the 3 month long like internship basically. I also ended up working at where I did my immersion at, and I feel like that was a very special opportunity and that I probably wouldn't have gotten anywhere else. I feel like I know Alex and I aren't the only ones who also got placed or got jobs at the place we did our immersion at. And so it's like we had these opportunities that I feel like are special to UCLA in a sense because I did have my like one of my faculty that is a UCLA faculty from the UCLA School of Nursing help me through the process, and then also just making those connections with the people at UCLA during my immersion, making sure that I was trying to like network and speak to the people I needed to speak to try to get this job, but then also with the support of the faculty at UCLA helping me with my resume, helping me practice my interview, I feel like was really like I'm very grateful for those opportunities that I got. And then like if I honestly couldn't have done it without them.
Okay.
One thing I always remember is they always have every year that yearly networking opportunity at Reagan where you could be any year at UCLA nursing, but you get to meet people who that work on those units or have worked on those units and they're upper, high positions, but you get so much knowledge and wisdom from them, and it just kind of helps you with everything throughout the whole nurse. That's why I think UCLA does the best job with their networking opportunities because you're in LA, like I said before, but it's just everyone they understand what you need to do to become a successful nurse, and they kind of like lay the pathway for that.
And one thing they had this year, they had like a big networking fair where like a bunch of hospitals came, and they had booths, and students can go to each booth, get information from the hospitals and like when their applications were, when the deadlines were, what the requirements were. And even in our emails, in our student emails, we get notifications of like, hey, USC is hiring, here's the flyer, or hey, like Kaiser's hiring, here's the information. And so all throughout senior year, we were getting these emails, and so if you had interest in a specific place, you could apply to it. And so I think that was really cool that they were kind of helping you see the opportunity so you didn't have to find everything on your own.
And then just to add to Alex and Aya's, kind of similar to Maggie's answer, in the program, you have to take this professional development class and you have to do the resume interview. And honestly, at the beginning, I thought like, why am I taking this? Like, this is just like a regular class. And then halfway through, I realized, oh shoot, I should take this seriously. So in that class, we had to do a professional portfolio. And I thought it was just foo-foo, like, oh, whatever, I'm just doing it for the grade. But I actually printed it out and bound it and took it to my in-person interview at Harbor UCLA. And the manager told me, I've never seen anyone do this before. This is really refreshing. And I was like, oh, really? This is okay, that's cool. Which is probably the reason why I was hired, because of my professional appearance. So when you're in that class, take it seriously.
How has your career progressed since graduating from UCLA's
Yeah, I guess
direct?
I'll start. So I graduated 3 years ago during COVID, and for me it was a little difficult because everything was so unknown. We're taking your NCLEX, and everything got pushed back by 6 months for me. So I graduated in June, didn't take my NCLEX till December. Had a job on the line basically. You pass the NCLEX and you start. My new grad job was at Providence St. Joseph in Burbank. Um, I was in the float pool, so I didn't have a home unit. I mostly just worked on I would float between neurology, cardio, telemetry, oncology, COVID, um, bariatrics, orthopedics. I got a very wide, my experience. I got a lot of different units I got to see and met a lot of different nurses on those floors. But I can say after that, I wanted to really broaden the horizons. So I went and got a travel contract with Kaiser in Ontario, and I worked there for about 5 months, and it was great. I got to see a lot of new things, got to experience a new hospital. I had never been in Kaiser during my UCLA rotation, so that was something new for me. And then after that, I went into I saw an application online that this Regal Medical Group was hiring for outpatient case managers. And I was like, this is something new. I could, learn more and broaden my nursing horizons. And I've been there now for almost a year and a half, and it's been great. I've learned how to, provide patient education, and it's different because it's not in person. A lot of it's on the phone. You're talking to patients. You might do a home visit from time to time to see their living situations, but we work with, social workers and the other primary care doctors and the pharmacists. Basically, we're doing everything we can to prevent hospitalization. So it's a different take. I did the hospital part. I learned how to take care of patients in the hospital, but this is doing everything to prevent them from going there, because patients get the best care at home. Everyone believes that. As long as you keep them at home, they will stay healthy. And when they go in the hospital, they start declining. They don't move around as much. So it's given me a different horizon look at nursing, but I've really enjoyed it. And it all started from the ground at UCLA School of Nursing. So it's only, the avenues and the different pathways just grow and grow from there. And I can't even begin to explain how much that helped me.
That's great to hear, because I know the three of us are only just starting, but I know there's so many things to do, and I'm very excited to see where my career takes me. But so I haven't really done much other than just start my new grad program, but there are a lot of faculty that I'm still in touch with. I talk to them from time to time. There's a lot of connections that you have at School of Nursing. So I know if I go back to school, when I go back to school, or if I change where I am in the nursing field, that I have connections and I have resources, and I know that there's people that can refer me. And so, yeah, I'm still just starting, but a lot of opportunity to come.
Were there any specific extracurricular or research opportunities that enhanced your educational experience at
I think
UCLA?
one of the best extracurriculars that's given to us in school nursing is ATD, Alpha Tau Delta, or yeah. Me and Alex we were on board of that for a while.
Maggie was also.
Yeah, but I think you were there. You were on board when I was still there.
Yeah.
So, but yeah, it was great. It's your nursing family. It's not just the bachelor students. You get the master's students. You get the doctorate students. I mean, you get to meet everybody. And I remember they would have these mock interviews. Those were great. Resume building, that was also awesome, because it just gives you all these different things that will help you further on. but they would also have professors, faculty come in, and it's not just they teach you and you know them in that setting, but you got to know what they did before UCLA, where they worked at UCLA nursing, what their career, how they became nurses. It was just great to see different, hear different stories, and I think that was one of the best things. I was in it all 4 years, and I really enjoyed my time doing that.
I guess for me, I'm a current staff research RN assistant, research assistant for one of the investigators. I'm more of an academic person. I really like building science, building protocols, science, wet lab stuff. When you think of science, the pipetting and the cell culture, in vitro, in vivo studies. And actually, my academic advisor, I'm pretty sure they still do this. When you enter, you're paired with an academic advisor. My academic advisor connected me with my current supervisor, an investigator, and we're looking at triple negative breast cancer and treatment modalities for it, since there are no there are therapies, chemotherapy and surgery, but that's basically it. Whereas other cancers have those other treatments and modalities that you can really kill off those cancer cells. So I'm more academically inclined, and the research at UCLA School of Nursing, it ranges from community-based to wet lab-based like me. I'm also in another lab that does occupational health research. The study will start next year, but my RN skills will be required since we're going out in the community and collecting patient samples. So yes, there's a lot of opportunity for those academics out there if you really like wet lab stuff, or if you like talking to patients. Yes, that's all I have.
The last piece of advice you would give to a prospective student wanting to apply to the direct entry program?
You're one of those 40, direct entry students from high school, or if you transfer any one of those 10 lucky students that get in. Really do your research of nursing and make sure it's really the career you want, and you're ready to take on the challenges. Yes, it's difficult, but it's a lot of reward at the end. I would say, just apply to all the schools that are, really catching your attention, and look into it, and really just do your research and study, and like the different nursing schools, because this program is great and there's many benefits that come out of it.
I guess for freshmen and sophomores, if you're listening to this, get in those clinical hours. So look for clinical volunteer opportunities and talk to some bedside nurses and see if that's what you really want to do. I know when I was in high school, I did that my junior and senior year, and that kind of led me to this path that I am in now. And also take those advanced science courses, those AP biology, AP chemistry, though that's really important, because that makes you a strong contender, that you are knowledgeable in your science and math fields. So yeah, when you're a freshman, sophomore, just think about that. For juniors and seniors, since you're now applying, in this phase of applying, really reflect on your other career options, because there are other options available for you as a career. Nursing is honestly, it's practical. Nurses in California make a lot of money, and if you want to prioritize building a family, that's all important. So really think about what you want to do in your life. I know this is really early since you're barely adults, but since this is a direct entry, you really have to commit and be ready for that. And don't ever try not to lose track of that passion that you have for nursing once you're in the program, because I know that can get difficult with your courses, but that's the advice that I have for the juniors and seniors, to really reflect on your other career options, and to start drafting those essays, because those essays for some of the UCS essay, you have only like 300 words, I believe. And that's such a small amount of space for the ideas that you have flowing in your head. But you do have that personal statement, I believe. I'm not sure how many pages it is, but yes, start early, because you want to revise and edit those essays. Yeah, so you should start early and edit those essays because it's important you to
I think just quickly, I agree. Take the science classes, do the research, do the volunteering. Be genuine in your essays. Why you want to be a nurse. And yeah, do your own research. We can give you information. You can find stuff online. Talk to people who you know who are nurses. You're working hard now, and then once you're in college, once you're in nursing school, wherever it may be, you're gonna still be working hard. It's still gonna be stressful. But my biggest piece of advice is take a second, congratulate yourself for making it that far, and don't forget to have fun. You know, college is supposed to be an amazing time. Like, I joined a salsa club my freshman year. I'm a terrible dancer, but it was still fun. You know, I learned how to rock climb. I have rock climbing friends now, and there's so much in college outside of nursing school that you can partake in. And so don't let the stress get to you. Have fun, live your life, and it's gonna be great.
And we know this is going to be super helpful for future students who will be applying to our school.
Thank you.
And
thank you.
Thank you.